Volcanic ash is produced during volcanic eruptions, as rocks and magma are violently shattered into tiny particles. This forms a fine powder or grit-like sand with particles that are hard and abrasive, not like the soft ash you'd find after a fire. Ash can travel a long way in the air, and so impacts can be widespread. But most impacts occur where the ash fall is heaviest, close to the volcano. Exposure to volcanic ash can be a nuisance and cause discomfort, but it can have more serious health effects for some people. Exposure to volcanic ash can cause problems with the respiratory system, the skin, and the eyes. These effects are mostly caused by airborne ash during an ash fall or afterwards when ash is stirred up by wind or human activities in a process called remobilization. Ash can irritate the eyes, causing them to become red, itchy, sore, and runny. Ash can scratch the eye if rubbed. Skin may also become irritated, which can cause discomfort but doesn't usually last very long. Irritation of the respiratory system is typically short-term too, causing a runny nose, sore throat, and cough. However, for people with pre-existing medical conditions, such as asthma or bronchitis, ash can irritate the airways, triggering tightness of the chest, wheezing, coughing, and shortness of breath. Some eruptions produce specific minerals or particularly small grains, which, in industrial settings, have been shown to cause long-term disease. It isn't clear if volcanic ash can have the same effects, and scientists continue to study the long-term impacts of volcanic ash on human health. Ashfall can also result in secondary injuries. Heavy ash falls may bury structures, and the weight can sometimes cause buildings to collapse. This might lead to traumatic injuries and deaths for those inside. People may slip or fall from roofs while cleaning up ash falls, or suffer injuries and ill health from the effort of moving heavy loads. And road accidents may be caused as ash reduces visibility and covers road markings, as well as making surfaces slippery. Scientists will provide information to emergency officials who will alert communities and advise on actions to take. The best protection is to avoid inhaling ash. This is mainly through reducing how long you're exposed to it. If you haven't been advised to evacuate, then it's best to stay inside as much as possible. Close windows and doors and cover other openings into the building. If ventilation is reduced, cooking indoors over an open fire or with gas is hazardous, as smoke and invisible carbon monoxide are produced. If possible, cook outdoors or increase ventilation to the kitchen area. When you go outside, avoid wearing contact lenses and wear goggles, head coverings, and long-sleeve clothing if you can. Masks will help, and the best are effective, well-fitted, industry-certified face masks, such as an N95, FFP2, or P2 mask. If you don't have one, a fabric face covering or cloth can help, like in the COVID-19 crisis, but this won't be as effective. If you have heart or lung conditions, it is particularly important to limit exposure and to make sure you carry your medications. Everyone should avoid activities that make them breathe harder to avoid inhaling more ash. Keep children indoors if possible because they don't always follow advice, and because of their size, their exposure can be greater. Be aware that impacts from eruptions may make it harder to access medical care and emergency services. Ash can contaminate food and water. While food is generally safe to eat, water quality and supply may be affected. Keep a clean supply of water at home in case water supplies are disrupted. If you use rainwater collection, cover the tank, disconnect downpipes, and if practical, consider removing gutters during large ashfall events. Limit your travel and drive slowly with a large distance between vehicles. If cleaning up ash, it will help to lightly wet it to stop it becoming airborne, but be careful not to use too much water and avoid washing ash into drains. Follow advice from emergency managers and work with your community to safely remove ash.